So snoring fragments or breaks up sleep. It affects your daytime energy. It affects your overall health. It affects your wellness, your immune system. It can be a precursor or really show that you are at risk for high blood pressure, type 2 diabetes, and other kinds of ailments. You can also be affected with your immune system, will not function as correctly if you're not sleeping well. The reality is, if you're snoring, you have some level of obstruction in your sleep, and that needs to be treated. So, Solea sleep is recommended for mild to moderate. So, Solea sleep is very helpful to treat snoring in the mild to moderate obstructive sleep apnea stages. If a patient has chronic or severe obstructive sleep apnea, then Solea sleep is not going to solve the problem, but it's certainly going to help. The CPAP is the standard of care, and there are oral appliances that are also very beneficial. But as an adjunct or a starting place in addressing sleep apnea, the Solea sleep can really help manage the the snoring and do that very non-invasively, non-surgically, and you can get back to your daily activities very quickly after that treatment. In dentistry, we have a unique opportunity to see what is going on in the gateway to the body. And we see that teeth are worn, we see large tongues, we see large circumferences, large necks. And those kinds of signs can lead to or point to the fact that a patient may not be breathing well. If they're not breathing well and not sleeping well, then they're fatigued, they're tired, they are not as functional, memory loss, cognition is an issue, high blood pressure, stroke, diabetes, irregular heartbeats, immune system issues are all tied to someone's ability to sleep and the connection then with the mouth and how we can help the patients sleep better and minimize those health effects. So often we will have a patient say that my wife tells me I snore, but I don't know that I do. So that's the first patient that is the first indication that maybe there's an airway issue. Maybe there's something that can be done. And Solea sleep, which tightens the tissue in the back of the throat, can be very helpful and be the beginning process or start the process in addressing sleep apnea. It's not for severe cases, but it certainly is part of the overall process and can take away snoring and help the patient feel better as well as their bed partner get a better night's sleep. So Solea sleep is really great in that one of the things that people don't like about coming to the dentist is the needle and the drill. Well, with the light beam that comes from the laser, there's no needle, there's no drill, there's no discomfort. The light shines in the back of the throat with a little bit of numbing agent, and within minutes, a patient will notice that they breathe better almost instantaneously. And that feeling lasts for months and months afterwards. It may be a year and a half before a patient may need a, a touch up to help with that process and to tighten that tissue and to keep the airway open. But very straightforward, non-invasive, and a wonderful way to enhance their lifestyle and that of their bed partner as well. When we tell a patient that we're going to use a laser, even though people are excited that there will not be a drill and there won't be a needle, they're still a little anxious about that technology. But once we are able to use the laser to treat their snoring, they're flabbergasted, they're excited about how easy it was, how they feel almost immediately that they breathe better, that they speak better, that they can take a deeper breath right there at that moment. And then that translates into a better night's sleep. And if they're sleeping better, then their partner is sleeping better too. And we get stories all the time telling us how much how enjoyable that is for their bed partner and what a good night's sleep everybody in the house had.